Hi guys, and welcome back. This is part 2 of Empire Interpreting's video tutorial series on how to work with an interpreter in a variety of settings. In this particular video, we're going to deal specifically with working with an interpreter in the medical field. Let's begin by discussing who is and is not appropriate to work as an interpreter in a medical setting. We get quite a few questions about whether or not a hospital can use this person or that, and I'd like to take a minute and address some of those questions. One of the most common we get is we have a staff member here who may know a little or may even be fluent in sign language. Can we use this individual? No. Despite the fact that this person may be able to carry out a conversation with the patient, they're certainly not certified, and with the wide variety of terminology and different situations that can arise in a medical setting, not only would this create a very poor bridge to communicate over, but also leave the hospital open for liability issues. The second question we often get is, well, we have a friend or a family member of the patient who may even be an interpreter, but certainly can communicate with them. Can they act as an interpreter in this setting? No. Despite the fact that this person may even be qualified, if they have that personal relationship, it's simply impossible to remain any sort of neutrality when conveying messages back and forth, once again leaving the hospital open to all sorts of liability issues. And then the last question we get, and often the one that creates the most conflict or at least confusion with medical staff, is, well, we have an interpreter. We don't know what their qualifications are, but we have an interpreter. Is this person okay to use? Maybe, but probably no. Unless they have the correct certifications, liability insurance, and some other very important pieces that we're going to get into in the next section here. Just using any given interpreter is not good enough in a medical setting. Now that we've established that we need to have a qualified interpreter in order to work in a medical setting, let's discuss exactly what qualified means. First, we have the certifications, which I've mentioned in previous parts of this video. Those certifications are the NAD and RID and or the IMIA. It's not necessary for you to totally know what those acronyms stand for at this point in time. What is necessary is for you to mention that to the agency whom you call when requesting an interpreter. Most reputable agencies wouldn't send an interpreter without those qualifications anyway, but by you specifically asking for them, it's another layer of protection that you've put on yourself in terms of liability. In addition to having the proper certifications, you also want to make sure that your interpreter has liability insurance. This provides an umbrella of protection for both the interpreter and the hosting medical environment should a breakdown in communication occur. And lastly, and this is the one that goes overlooked quite often, is to make sure that the interpreter has experience in a medical environment. There are lots of interpreters who have all the certifications in the world, but may not have worked in a hospital or medical environment in the past. This again falls to the responsibility of the agency whom you are working through. They should have detailed records on how often or how much time a particular interpreter has spent working in the field. But again, this is a question it doesn't hurt you to ask when calling and requesting for an interpreter. In this last part of the video, we're going to give you some specific pieces of advice for working with an interpreter in a medical setting. The first piece would actually be to go back and watch our first video. All those generic tips are still going to be in play working in a hospital or a doctor's office. Second tip would be to keep in mind when in a hospital room, specifically if a patient is in a bed and there is a doctor with a nurse or multiple nurses, anytime there are multiple people in a room, to try and pace the conversation so that one person is talking, giving time for the interpreter to then relay that message before the next person answers the question or responds to the initial piece of conversation. Also, make sure to note on the patient's chart or on the whiteboard that the patient is deaf and or non-English speaking. This helps with other doctors or nurses coming in and out of the room It helps to keep the continuity of communication fluid, and it helps to avoid any awkward situations where a doctor or nurse may try to engage the patient not knowing that there is a language barrier in the first place. Make the interpreter aware of when shifts are about to change or when a new head nurse is coming on. If at all possible, try to introduce the interpreter to that head nurse. Remember that it's the interpreter's job to convey a message and not to carry it. Therefore, don't ask the interpreter to deliver information to the patient without you being present. Be mindful of privacy issues for both your patient and the interpreter, and leave time for your interpreter to leave the room when necessary. Lastly, it's important to understand the positioning of the interpreter when medical staff is not in the room with a patient. An interpreter should be placed outside the front door of the patient's room, ideally in a chair, to follow medical staff in and out as they come to visit the patient. We often get questions as to why is the interpreter just sitting outside? Well, the answer is twofold. First, we're trying to limit the patient's exposure to germs and potential complications by keeping the interpreter away from them as much as possible. Secondly, oftentimes patients feel as if they have to entertain somebody who's in the room with them and not allowing them time to get adequate rest. With deaf patients, quite often, the act of signing itself can raise the blood pressure, creating other complications. That ends our second video, guys. As always, feel free to contact us with any questions you might have about this particular topic. Our next video will address working with an interpreter in an academic setting. Thank you for watching. I am Jay with Empire Interpreting Service.